Cancer kills 10 million people every year. Doctors fight it with two completely different weapons. One is a poison the doctor injects into your blood. It travels everywhere. The other is a beam of light fired from a machine. It hits one spot. They sound similar. They are nothing alike. The first is chemo, a poison. Doctors inject it into a vein, or you swallow it as a pill. It travels through every blood vessel. Every organ sees it. Every cell sees it, including the cancer. The second is radiation, a beam. A machine the size of a small car aims at one spot on your skin. The beam crosses your body. Almost all the energy lands in a single point, the tumor. One floods, the other punches. That's the easy part. The hard question is what each one is doing once it gets where it's going. How does a poison decide which cells to kill? It doesn't see the cancer. It can't read tumors. It's just a chemical in your blood. Yet patient after patient, the cancer dies, and most of the patient survives. That's not luck. There's a rule. It explains everything from why the hair falls out to why the bone marrow nearly fails. Coming up next.
How does chemo kill the cancer without killing the patient? It doesn't kill the patient, but it gets close. The mistake cancer makes is dividing too fast, faster than almost any cell in your body. Chemo targets the machinery cells use to divide. Hit that machinery, the cell can't copy itself. It dies instead. But cancer isn't the only thing that divides fast. Hair follicles divide fast, so your hair falls out. Your gut lining divides fast, so you get nausea. Bone marrow divides fast, so your blood cell counts crash. 3 days after a chemo dose, your white blood cells fall by half. A bacterial infection that would normally fade in a day becomes life-threatening. Doctors run chemo in cycles. 2 weeks on, 1 week off. The marrow recovers, then the next dose. The patient's body is rebuilding what chemo just destroyed, while the cancer keeps dying. Because cancer divides faster than the marrow. Cancer dies first. So chemo wins by being blunt enough to kill anything in a hurry. But blunt has a cost. The patient pays it. The cancer pays it more. What if you could be precise instead? Not blunt, surgical. What if instead of a poison flooding the whole body, you used a beam aimed at a single point, every photon on purpose? That's where radiation comes in.
How does a beam of light kill a cancer cell? When the same beam takes a chest X-ray and you walk out fine. Same particles, same energy, same wavelength. The chest X-ray sends a few photons through you. The picture is the photons that bounced off bone. The rest pass through. You feel nothing. Radiation therapy uses the exact same particles, aimed in a billion times bigger flood, every second. A photon hits an atom in your cell. The collision strips an electron off. The atom turns into a charged ion. Ions break chemical bonds, including the bonds holding your DNA together. The DNA snaps in two. Now, here's the part you should remember. Every cell, including a cancer cell, takes the exact same hit. The DNA snaps in both. The damage is identical. Then something happens overnight in one cell, and nothing happens in the other. By morning, the healthy cell looks untouched. The cancer cell is dead. What's the difference between sundown and sunrise? The healthy cell did something cancer cells can't do. It's the same reason doctors split the radiation into 30 days. Never one. Same total dose. One way kills the patient. The other cures them. So if both treatments work, but they're so different, why does a doctor ever pick both at once? Coming up.
When does a doctor pick both chemo and radiation instead of one? It's not hedging. It's not a worse cancer. It's not a sicker patient. The doctor is betting on a multiplier. Some chemo drugs jam the machinery cancer cells use to fix DNA breaks. The chemo isn't trying to kill the cell on its own. It's setting it up. Then radiation comes in and breaks the DNA. The cancer is fighting two attacks at once. Chemo blocks the repair. Radiation does the damage. Cancer can't fix what's broken. Doctors call this radiosensitization. Head and neck cancers? Combined. Locally advanced lung? Combined. Cervical? Combined. Kill rate doubles. So do the side effects. Hair, marrow, gut, hit twice. The oncologist monitors blood counts daily. IV fluids, anti-nausea drugs, growth factors push the marrow up. So back to the question we started with. Why does the same disease get one patient chemo, the next radiation, and the third both? The decision rule is one word: pattern. Cancer in one place, radiation. Cancer that's already spread, chemo. Cancer local but biologically aggressive, both. The pattern dictates the weapon. If you want to see another problem doctors solve every day, how they catch a heart attack before it happens, that's our latest episode. Link below. Would you accept 2 cancer treatments at once if it doubled your cure rate? Yes or no?